Abscess, incision and drainage. Procedure. Part 1. Introduction. Abscess, incision and drainage is an operation within the scope of the registered nurses that can be performed in the positions that do not harm the vital organs of the body. Abscess dissection is performed when the abscess is purulent failure, initially assessing whether the abscess is convex, soft place, or cold fluctuate or not. If the abscess is behind the mastoid, neck, under the chin, armpit, or groin, it is usually caused by lymphadenitis, which should be referred for further appropriate treatment. Part 2. Objective of abscess, incision and drainage. The purpose of abscess, incision and drainage is to drain pus and reduce skin infection. Part 3. Preparation of equipment. Before preparing the equipment, wash the hands with a 7-step hand washing method. The equipment for dissection is as follows. 1. Set of abscess dissection instruments and equipment. 1.1. Acute forceps. 1.2. Anon-tooth forceps. 1.3. An arterial clamp. 1.4. A square fabric with a central hole. 1.5. 4 pieces of 4x4 gauze pads. 1.6. 5 cotton balls. 1.7. A gauze drain. 1.8. A scalpel handle. 1.9. A surgical blade number 11. 1.10. Accurate spoon. 1.11. 2 cups for containing skin cleanser. 2. Anesthesia injection equipment. 2.1. A needle number 18. 2.2. A needle number 23 or 25. 2.3. A 5 ml or 10 ml syringe according to size of the incision. 2.4. Local anesthetic such as 1% or 2% lidocaine. 3. Protection device. 3.1. Sterile gloves. 3.2. Goggles or face shield. 3.3. Surgical mask. 3.4. Apron. 4. Normal saline solution. 5. Skin cleanser such as povidone solution. 6. Skin scrub such as povidone scrub. 7. A tender 20 ml syringe with a cup of normal saline solution for irrigation. 8. Plaster tape. 9. A kidney-shaped bowl. 10. A needle disposal bin. Part 4. Abscess, incision and drainage procedure. 1. Position the patient appropriately. 2. Wash the hands using a 7-step method. Wear the goggles and the sterile gloves with the sterile technique. 3. Prepare the anesthetic. 4. Clean the incision area using povidone iodine scrub or hepitane scrub, then paint with povidone iodine solution. If the area is hairy, consider shaving it off first. 5. Press a square fabric with a central hole on the incision area. 6. Anesthesia injection. 6.1. Ask for a history of anesthetic allergy. 6.2 Inform the patient before giving local anesthesia. 6.3 Inject the local anesthetic. Be careful not to let the anesthetic enter the blood vessel. Inject with a needle number 23-25 at the dome of the abscess in the direction of the incision cut or around the lesion by holding the needle parallel to the skin. If the anesthetic is injected appropriately, the skin around the lesion becomes pale or surrounding skin blanches. Drug allergy should be observed. 6.4 Test for numbness by using the tooth forceps hold the skin around the lesion. If the patient is no pain, it indicates the numbness and the operation can be performed. 7. Place the surgical blade along the skin crease, natural folds, by landing the blade at the fluctuation where the skin is thinnest. Make a long incision as the length of the abscess cavity. Cut the skin until the pus starts to flow out. Do not cut deeply into the pus without seeing the bottom of the wound, as it can affect the important structures. A too small incision is not sufficient to drain the pus, often cause the abscess does not heal. 8. Drain the pus or discharge as much as possible or may use cuvette to gently scrape. 9. Use normal saline solution to irrigate in the purulent cavity until it is clean. 10. After draining the pus out, use a gauze drain moisten normal saline inserts into the abscess cavity loosely and hold it on the wound's mouth to prevent it from closing. 11. Cover the wound with sterile gauze. Part 5. Recommendations. Recommendations for patients before going home are as follows. 1. Take antibiotics and painkillers according to the prescription. 2. Be careful not to let the wound get dirty and wet. 3. If the wound area is unusually painful or is bleeding all the time, come back to see a doctor before the appointment. 4. Make an appointment for wound dressing 1 to 2 times a day, depending on the amount of pus, the size, and the location of the abscess. Part 6. Conclusion. In nursing practice, nurses often encounter patients with health problems related to skin abscesses. If the abscess is in a harmless position, the incision and drainage is considered procedure that nurses can perform as it is a minor surgery that uses local anesthesia or the sterile technique. The patient should be given antibiotics after the procedure. Moreover, the nurses should give the patient post-operative advice in order to appropriately self-care.